Hi all, this is Dr. Janvi. Today's topic is cancer cervix. Cancer cervix is one of the preventable and curable disease if detected early and managed effectively. World Health Organization in coalition with member states and countries drafted a global strategy in order to eradicate cervical cancer by conducting campaigns in the month of January, which is considered Cervical Cancer Awareness Month, and people participating in the campaigns wear teal colored ribbons. This video is intended to raise awareness of cervical cancer causes, risk factors, prevention, screening, and management. What is cancer cervix? Cancer cervix is a type of cancer that occurs in the cells of the cervix. Now, most of my patients in OPD ask me where exactly cervix is located. Cervix is the lower part of the uterus that connects to the vagina. Again, uterus. Uterus or womb is organ and body of woman in which a baby develops before birth. We are concerned about cancer cervix to be major public health problem because 604,000 new cases and 342,000 deaths have been reported due to cancer cervix in 2020 by World Health Organization statistics report and is considered fourth most common cancer in women worldwide. The cause for cervical cancer is human papillomavirus, which is transmitted through sexual contact. Risk factors of cervical cancer: many sexual partners, early sexual activity, other sexually transmitted infections, a weakened immune system, smoking, exposure to miscarriage prevention drug. Now I'll explain how each one becomes a risk factor for the development of cervical cancer. Not everyone in the world who gets exposed to HPV virus develop cancer. In most of the individuals, HPV infection resolves itself without any intervention. Many sexual partners. Each partner may carry a different strain of HPV virus. Exposure to different strains of HPV virus can cause persistent infection which may lead to cancer. Early sexual activity. If sexual activity is started at an earlier age, there is increased exposure to HPV at early age where this persistent infection may lead to development of cancer cervix. Other sexually transmitted infections like chlamydia can result in cancer cervix if infected with HPV virus. A weakened immune system, either because of HIV or due to any other cause, can be another risk factor if infected with HPV virus to develop into cancer cervix. Smoking. Tobacco byproducts have been reported in cervical mucus among women who smoke. Therefore, smoking along with HPV infection can lead to development of cancer cervix. Next one is exposure to miscarriage prevention drug. If your mother took a drug called diethylstilbestrol while pregnant in 1950s, you may have an increased risk of a certain type of cervical cancer called clear cell adenocarcinoma. Diethylstilbestrol is now banned, but in rare cases it can be advised in some women, but not those who are pregnant. Prevention. Increasing screening and prevention are key components of the effort to eradicate cervical cancer. Human papillomavirus vaccines work best if administered prior to exposure to HPV. Therefore, to prevent cervical cancer, World Health Organization recommends vaccinating girls aged 9 to 14 years when most have not started sexual activity. Human papillomavirus can cause several types of cancer other than cervical cancer, like mouth cancer, that is oral cancer, penile organ, that is male organ, penile cancer, vaginal cancer, vulvar cancer, anal region, that is anal cancer. Countries like Australia recommends vaccinating boys of the same age group to prevent anal and penile cancer caused due to HPV virus. There are actually 3 vaccines available to prevent cervical cancer: Cervarix, Gardasil, and Gardasil 9. In India, 2 vaccines are presently available: Cervarix and Gardasil. Gardasil is quadrivalent vaccine where it can prevent up to 4 different strains of human papillomavirus, whereas Cervarix is preventing up to 2 different strains of human papillomavirus. There are 3 doses of vaccines given. Cervarix is given 0, 1 and 6 months, whereas Gardasil is given at 0, 2 and 6 months. And the dose of the vaccine is 0.5 ml and it is given intramuscularly. Patients who come to my clinic ask many questions regarding these vaccines. First and foremost question is, what will happen if vaccine is given along with the other vaccines? They can be given with the other vaccines like DTaP, hepatitis B, or any other vaccines. Till now, no adverse outcomes have been reported. The second question is, what if they are given to pregnant women? Till now, there are no serious outcomes if given in pregnant women, but better not to give to pregnant women because these vaccines are intended for people who have not yet started their sexual activity and who have not been exposed to HPV virus. The third question is, are the vaccines costly? Yes, they are costly. The cost ranges up to 4,000 rupees per dose. Researchers believe that cervical cancer can be prevented only if all the 3 doses are taken according to the schedule. I recommend screening for all women who have crossed 25 years of age, whether taken vaccine against HPV virus or not. And this testing is done among women who have no symptoms and who are absolutely healthy. When screening detects a HPV infection or precancerous lesions, these can be easily treated and cancer can be avoided. This is a picture showing gynae doctor performing cervical sampling. To treat precancerous lesions, cryotherapy or thermal ablation are recommended. The first picture shows cryotherapy where freezing temperatures are used to remove the precancerous lesions, and the second picture shows thermal ablative therapy where high temperatures are used to remove the precancerous lesions. Precancerous lesions are the lesions in which the cells are structurally and morphologically abnormal. If there is continued infection in these cells due to HPV virus, then this can lead to cancer. Management of invasive cervical cancer. If precancerous lesion progress to invasive cervical cancer, symptoms of early stage cervical cancer include irregular blood spotting or light bleeding between periods in women of reproductive age, postmenopausal spotting or bleeding, bleeding after sexual intercourse, increased vaginal discharge, sometimes foul smelling. As cervical cancer advances, more severe symptoms may appear, including persistent back, leg, or pelvic pain, weight loss, fatigue, loss of appetite, foul smell discharge and vaginal discomfort, swelling of a leg or both lower extremities. Treatment of invasive cancer. The treatment plan depends on the stage of the disease and options include surgery, radiotherapy, and chemotherapy. Palliative treatment becomes a treatment of choice once the cancer becomes incurable and is to relieve the symptoms of cancer, such as pain, etc. Thank you all for watching my video, and for any health queries, you can mail to inhealthforyou@gmail.com.